Hello, everyone. My name is Cindy Owens Bridges. I'm a nursing instructor for Holmes Community College Associate Degree Nursing Program. And I have a little presentation here I want to go over with you as nursing as a profession. This also includes nursing theory. So the text for this class is Chapter 1 and Chapter 2 in your Taylor Fundamentals book. We're also going to refer to the nursing Holmes Community College Nursing Program Student Handbook as well. So some things that are from your syllabus that we need to discuss are some historical nursing practice, nursing as a profession, the aims of nursing, different professional organizations, ANA standards of nursing practice, the different ways to be educated and prepared to be an RN, the responsibilities, our trends, and then nursing theories. We're going to talk about very limited nursing theory, nursing research. I've done a separate module on evidence-based practice, so I'm not going to cover that in this presentation. And in that evidence-based practice module, it demonstrates the link between theory and knowledge and bedside nursing. I just want to remind you that you are going to be responsible for all assigned material. We do not spoon feed you in the nursing program because we're preparing you to be an adult professional learner and an adult professional nurse. So if you have an assignment for textbook, reading handouts, webpage, you're responsible to know that. You can't come to us and say, are we going to be tested on that? We don't teach you to pass a test. We teach you what you need to know to be a nurse. Not everything you need to know we're going to test you on, but you still need to know it because you're going to need it at some point to take care of a patient. No recording of my devices if I'm teaching live, but since this is recorded, you will have that. This is just for face-to-face. We lock the door when class starts. I am going to post this PowerPoint as a recording. You need to take notes. It's in your best interest. We do not teach to the test. Student learning outcome is something that we want you to get out of our whole program. There are different outcomes, and the one that applies specifically to this is professionalism. This is where we say the graduate will demonstrate accountability for the delivery of standard-based nursing care that is within the legal, ethical, and regulatory framework of nursing practice. And these are just a few little funnies. I'll have some of these dispersed throughout. It says that bottle of champagne is for when I get into nursing school. That bottle is for when I graduate nursing school. That bottle is for when I get a job. And the last bottle is for when I get a social life. I say that to let you know that for the next 2 years or 1 year, whichever track you're on, you need to be prepared. Your family and friends need to be prepared to give you up until you're done. So there won't be any boating outings on the boat or going to the beach or anything. Every minute needs to be devoted to becoming a nurse. There'll be plenty of time to do the other things in life, but you've made the decision to go to nursing school, and that will be what you focus on for the next year or 2 years. I want to study every minute of every day, so I take pages out of my text all over the house, and that's what you're going to feel like you're doing. So this is from the nursing handbook. This is the purpose of our program. We want to prepare a registered nurse generalist. That means when you get out, you should not, I cannot say this enough, should not go straight into a specialty such as ICU or CCU. Are some of you going to do it? Yes. Are you going to regret it? Possibly, probably. Do I recommend it? No. You are preparing you to be a generalist, not a specialist. So you got to learn general nursing care. When we're preparing you, you have attained the minimal competency for productive employment. And we also want to provide equal access for higher education. As a student nurse, you're going to be held to the same standard of care as a registered nurse. We say, how can I do that? I'm not RN. No, but once you've checked off on a skill and you've learned the skill, you're expected to perform that skill at the same level of an RN, or to let someone know you can't. Your degree of experience and knowledge would be considered if something goes wrong, but you're held to the same standard. That's why you have an instructor with you at clinical, to make sure that you're not going to hopefully catch you before you do something unsafe. So some of the things we're going to talk about is our historical perspective, our aims of nursing, the nursing profession, ANA standards of care, responsibilities, and future trends. Now, this is something that I wanted to talk about. You see this RN, RNC, LPN, LPNC, BSRN, ADRN. This is some of the titles that you will get as a nurse. So RN, or RN certified, LPN, LPN certified. BSRN means you got your bachelor's degree in nursing. ADRN means you're an associate degree in nursing. MSN means you have your master's. With your master's, you could also be a FNP, family nurse practitioner, or you could be a certified family nurse practitioner, or critical care RN, or acute care nurse practitioner board certified. I mean, it goes on and on and on. All this to say is there's somewhere you can work to find your niche. So nursing license, you're going to be an RN. When you sit for those boards, you're just going to be an RN. Just RN. It don't matter if you're a bachelor's or an associate, you're never going to see. And please don't ever, when you get your bachelor's degree, do not write BSRN. You're just an RN, no matter which route you go to. Now, once you get your master's, you put MSN, comma, RN. You always put the highest degree earned first, okay? Now, this is just in, all this here is just a few, and this is just in the A's. So you can search for certifications and credentialing of nurses, and these are just the things you can get. I mean, advanced certified hyperbaric registered nurse, AIDS certified registered nurse, advanced nurse lactation consultant. I mean, then there's in the B's and the C's and the D's. So it's so many things that a lot of people don't know what we do as nurses. Well, heck, we can't even do it ourselves. What I'm trying to bring for you to understand is, to be a physical therapist, there's one route. That's it. DPT, Doctor of Physical Therapy. There is no all these AD, BSN, MN, all that. So that's it, DPT. Ours is so fragmented. There's so many different routes to go that we have all these different certifications and things. So it's hard for people to understand. What is nursing? Well, nursing is not only a science and a profession, but it's also an art. That means you will develop your own artful way of doing things. The way you set up your little sterile tray for to do sterile wound care, that becomes your art. The way you wrap a wound. I worked with an LPN one time, and I'm telling you, in all the years I've been a nurse, she made the most beautiful dressings to an extremity. They were perfect. They were beautiful, and I could not replicate that. But that was her art. She had defined her name and as a great wound nurse, and she could wrap those wounds. So she had made that her little thing, her art. You're also a servant to the community. I think this has been lost a lot. A lot of people, they want to be a nurse, and they want to have the scrubs on, and they want to make the money, and they want to sit at the nurse's station, but they don't want to serve. Well, I hate to tell you, but you are signing up to be a servant, and you're going to feel like a servant by the end of your shift. If you're going into this for the money, then you probably are not going to enjoy it, because nurses are servants. A lot of times, to the point that we put patients above our own physical health sometimes. So just remember, you are there to serve. You're going to utilize the nursing practice as defined by the Board of Nursing, and that you're going to talk about that more in legal ethical. The client or patient is the center of what we do, and that can be the patient themselves or the community or the family. And this can be very challenging because there's so many needs of the patient and family and community, and there's so many different settings. So let's talk about the historical perspective. Illness in the very earliest of civilizations was considered maybe supernatural, like that angered the spirits, or they had done something wrong and that the spirit was mad at them, and that's why they were sick. So the first places where any kind of treatment was sought out was at religious temples. So they became the center of primitive medical care. So in addition to doctoring the person spiritually, it addressed physical ailments as well. Then it entered the early Christian period, which promoted love and caring for the earth. Nursing was a natural fit for that because nurses, used holistic care and herbs and different things to help take care of the patient. There was a group of religious women that first organized to make home visits to the sick and participate in the burial of the dead. So this is one of the first records we have of someone nursing. When nursing first began, it was considered a calling, a religious calling, a vocation. Someone would be called to be a nurse and to serve their God. Nurses often had a poor recognition or reputation in society. Back in the 1800s, a lot of times the nurses were considered dirty because they were touching sick bodies, so it was not looked upon very well. That is true for Florence Nightingale. At the time that she was a nurse, nurses were considered low class and dirty. Florence Nightingale was from a very aristocratic family, and they felt that it was beneath her to be a nurse. But if you ever get a chance to read notes on nursing, it is her notes that she has written herself, and she kept like a journal and some of her thought processes. And that's kind of what nursing is based on. It's called Notes on Nursing by Florence Nightingale. She's known as the founder of nursing. She established the first nursing philosophy based on health maintenance and restoration. She viewed nursing based on a spiritual philosophy. She thought that if you place the body in a state to be free of disease and recover from disease. So she felt like if you could get the body clean and well fed and well nourished and warm, you would give it the best chance for the environment to act and help the body recover from disease. She did not begin her training as a nurse until the age of 31. During the Crimean War, she went and organized nursing care for the military. So before this time, she was just learning kind of on the streets with people, going house visits. There was no organized nursing. But during the Crimean War, she actually organized the women and they started giving care to the soldiers. One of the things she found out, though, and she's kind of the mother of infection control too, is after battles and things, they would have all these soldiers laying around. They'd have some people with their legs rotting off next to somebody that's dying, next to somebody that's not that sick, and they were all together and diseases were being passed. And you got to remember, they didn't understand bacteria and diseases and all that at this point. Well, what she would do is during the middle of the night, she would go with her lamp. That's why she's called the Lady in the Lamp. And she would walk in between the soldiers, and the ones that had died, she would get their bodies taken away from the ones that weren't. She would change the bandages, and she would get the ones that were critically ill and remove them from the ones that weren't. So she didn't realize it, but she was practicing infection control. Those simple acts of cleanliness, she started to see a great improvement of outcomes and decrease in death rate. So she continued along that line where she started letting the women dress alike. They started boiling and cleansing everything. And the cleaner they got, the less complications, the longer the lifespan. And she just started building on that. She helped elevate the status of all nurses. She established a training program in England. From that, then other nursing education formed, but it was very fragmented. So what you had going on at this training would be different than the nurses at this training. So the war kind of helped create and establish like a manual or a very first how to be a nurse. Then later on, hospitals had their own training, like way back when I became a nurse. Further than that, I worked with some nurses that had went through diploma nursing. So down in Baton Rouge, you had some nurses that went to work for Our Lady of the Lake Hospital. They went through their nursing program, and they were Our Lady of the Lake nurses. And they had a hat that said Our Lady of the Lake. Well, then you may have somebody at St. Dominic's in Jackson that went through their nursing program, and they were a St. Dominic's nurse. Well, then the boards came out, they took the board of nursing, but what they learned at Our Lady of the Lake at Baton Rouge may be different than what they learned at St. Dominic's. So it was very fragmented. So once that was when it was called a vocation. Nursing was not a profession at that point. It was just a vocation. You had doctors and you had nurses. Nurses were the handmaiden to the doctors. They did exactly what they told them to do, but they were not a professional. Once nursing entered academia, or you had to go to college and earn classes and degrees, that's when it became a profession. Please take the time to watch this first video. You're going to skip to second 26. The other two videos at the bottom are some you can watch on your own, but it is very rich. I really want you to take time to watch it. It's very interesting, okay? So what are the aims of nursing? Well, the first thing we want to do is promote health. By promoting health, you can prevent illness. If we can't prevent the illness and they're already sick, then we're going to try to restore their health. And if we can't do that, then we're going to help them cope with a disability or death. Our goal is to provide effective, research-based nursing care specifically tailored to each client's needs. So if you have not watched the evidence-based practice module, then you need to stop right here and go watch it so you'll understand what this sentence means. This sentence means to provide effective, research-based nursing care specifically tailored to each client's needs. The skills that you need to be a nurse are the cognitive domain. So that's what we're starting to teach you now in nursing school. So as a nurse, you need to be still a lot of times and think about things. One of the biggest things you're going to hear yourself saying is, I wonder if. You have to be aware of what's happening. You have to wonder what's happening, what could have caused it, what's going to happen next, what could have be done to prevent it, what can keep it from happening again. All that is part of critical thinking, and that's what you're going to learn in nursing school, is the cognitive domain. We also follow scientific rationales for the patient's plan of care. That means we don't just do something because we think it's a good idea. There's scientific data to support it. So an example would be, when I became a nurse and someone had the beginning stages of a bed sore, we were taught to rub it to increase the circulation. Well, that's 20-something years ago, and a lot of research has been done, and now that is not the best thing to do. They have determined that that causes more tissue damage. So as the evidence came out to prove that something else was better, the nursing profession has adopted the revised scientific rationale. Rationale is another word for reason. What's the scientific reason for doing something? You also have the technical domain. This is where nurses have to learn to use equipment. You have to be competent in it. That's when we do our checkoffs. We're making sure that you can use your equipment. Ethical and legal skills, you have to understand when something is ethically not right or unethical and what to do about that. And you have to be trustworthy, accountable, effective, always advocate or speak up for the patient, adhere to nursing standards, and use your legal safeguards. So health promotion is when someone is motivated by a desire to increase their well-being or health potential. So that's before you get sick. You want to promote your health. So you may decide you want to lose some weight before there's even a chance of being ill, or you want to exercise. Illness prevention is used to reduce the risk for illness. And then restoring health are those that fall primarily to the nurse, such as taking the vital signs. We're going to assess the patient, provide care, talk with other people, things like that. So what is nursing? This is another video I'd like for you to watch. There are 5 stages of nursing competence. There's the novice nurse, then advanced beginner, competent, proficient, and experts. Patricia Benner identified these 5 stages of nursing competence. You are still in the advanced beginner stage when you graduate. That's as far as you get. So right now you're novice. I don't even know if you're to the point of novice yet. You're just getting started. But by the time you graduate from our program, you will still only be an advanced beginner. That means you are not fully competent at so many things. You know enough to know that something's not right and how to stop it. Second and third year nursing students make decisions not only on facts and rules, but previous experiences. First semester students learn facts and rules, and that's how they do things. You do not become competent, proficient, or expert until you've been a nurse for years. And these are some slides just to talk about it. A novice is beginner with no experience. You're taught rules to perform tasks. They're independent rules, and tell me what I need to do and know, and I will do it. Advanced beginner, this is where you are when you graduate. You've gained prior experience in maybe first, second, and third, and fourth semesters. You can recognize recurring things. Your principles are based on your experiences. You begin to formulate your own guides of actions. Competent, this is about once you've been a nurse for 2 to 3 years. Proficient is where you perceive and understand situation as whole parts, learns from experiences what to expect in certain situations. And then expert is way down the road. This is just another little funny. I spent every last cent on nursing school, so I was hoping you'd let me finance this stethoscope for 36 months. So nursing is a combination of knowledge from the physical sciences. This is Florence Nightingale in the upper left. I'm not exactly sure that is in the bottom left. I think that's Claire Barton. I'm not sure. But nursing is a combination of knowledge from physical sciences, humanities, social sciences, clinical competencies to meet the skills needs. So that's your biology, of course, your psychology, and then your skills. It is autonomous, that means independent, but we also collaborate with others, such as doctors, therapists, families, groups, and communities. We care for the sick and the well. In order for a job to be considered a profession, it must contain the following: a well-defined body of specific and unique knowledge. That means there's specialized knowledge and skills just for our profession of nursing. Just like as an architect, they have special knowledge and skills that I don't know how to do, but they don't know how to do my nursing skills. We have recognized authority by a professional group. That means we can stand and say we speak with authority on this subject because we know nursing inside and out. Our authority is the American Nurses Association. There's a code of ethics that we abide by. We have a set of standards. There's ongoing research to always be looking to see how it can be better, and then we function independently. All that is included in the profession. When you finish our program, you will take the board exam. That's called the National Council Licensure Examination, or NCLEX. It is a standardized exam that each state board of nursing uses to determine if a graduate student is prepared for entry level, not a CCU or ICU. If you're ready to be safe enough to practice at the bedside with supervision, that is all the boards do. Once you pass the boards, you get your RN. HIPAA is something you'll learn more about later. You'll learn about that in your legal ethical. There's a module you need to do in ATI. If you've not done it, you have to have that done before you can go to clinicals. HIPAA stands for Health Insurance Portability and Accounting Act. It is a public law. It was enacted in 1996. There are certain standards for paper and electronic exchange of information. We cannot disclose personal health information without the client's consent. The client is given information on admission. So anytime you've gone to the hospital or the clinic, you sign their privacy statement, which is HIPAA. And that's saying that you can place restrictions on your information, who can get your information, and who can't. This is another great video. I know I have a lot of them. I usually show these in class if we're live, but in the interest of time, I'm going to give it to you and you can go watch it. So how do you become an RN? Well, you can be an LPN first, which is licensed practical nurse. Some states call them licensed vocational nurses. It takes a year from start to finish. A diploma nurse is the one I was talking to you about, Lady of the Lake or St. Dominic's. You go to a certain hospital for 3 years. They got a diploma and they set for boards, but they did not have a degree. They were not considered professionals at that time. Once nursing became a profession, they grandfathered those diploma nurses in. So to be a registered nurse now, you have to go through an associate degree or a bachelor's degree. It's 2 to 3 years of actual nursing school with 1 year prereqs for an associate and 2 years prereqs for a bachelor. They have the same scope of practice. The difference is with the bachelor's degree, you have all the other components that any other bachelor's degree has, such as 2 histories of literature, stuff like that. And you also learn some higher management. You can be an RN, associate degree RN, and then you can also upgrade to the BSN. Then they also have an accelerated BSN program. If you have a bachelor's degree in some other science, you can go through the BSN program, accelerated. Now, once you finish your bachelor's degree, then you can go into graduate level, which is your master's and doctoral prepared RNs. So MSN is Master of Science in Nursing. DNP is Doctor of Nursing Practice. That is generally your nurse practitioners now. PhD is a Doctor of Philosophy. DNS is Doctor of Nursing Science. There's some RN to MSNs programs, RN to BSN, BSN to MSN. Just all kinds of ways you can go to get all this. I want you to know the difference in-service and continuing ed. And in-service is provided by your employer. It's requirements for employment. So if you work at a hospital, everybody has to go through their infection control in-service every year, or you can't keep your job. That's an in-service. Continuing education is where you go and you are actually offered a certificate for so many hours that you went through that continuing education. So this is just a table that sums it up. You can have your associate, your bachelor's, your LPN to RN, or your previous BN. The main difference of ADN to BSN is management and the direction a BSN can provide. The BSN, there will be certain jobs that you might want to apply for that are only open to BSN or higher. You may see clinical nurse specialist or CNS. They have an advanced degree. They're considered an expert in some type of clinical nursing practice. Your nurse practitioner, there can be NP or certified family nurse practitioner or nurse practitioner board certified or direct doctor of nurse practitioner. It doesn't matter if they're a nurse practitioner, still considered an advanced nurse degree. Nurse anesthetist, certified, trying to get this right, nurse anesthetist. That's right. Certified and registered nurse anesthetist. I'm sorry, I couldn't talk today. It completes a course of study in anesthesia school. They work independently, but they have to be with an anesthesiologist, so some kind of consulting matter. Then you got a nurse midwife who focuses on delivering babies and prenatal care for uncomplicated pregnancies. Nurse educator, which is what I am. I have my master's degree in nurse education, and you can teach in colleges or in clinical settings. Then you have nurse administrators and researchers. So it's endless what you can do and where you can go once you get that RN. Here's some professional nursing organizations. These are not policing. These are not authoritarian as far as can discipline you. These set guidelines. They do research. So you got your International Nursing Organization, your American Nurses Association, your NLN, National League for Nurses, AACN, and NSNA. The one you really need to care about is ANA. When you become a member of Mississippi Nurse Association, you're automatically a member of ANA, and they have a lot of political power and they speak for us as a group. And the other one might be our accrediting body that accredits the school. So let's look at the ANA Standards of Nursing Practice. Now remember, this is not for discipline. This is not Nurse Practice Act. This is the standard that they set. Your Nurse Practice Acts in your states are usually based on the ANA Standards of Nursing Practice. So the American Nurses Association will look at things and establish a standard. If you don't meet that standard, then the board in your state may come provide disciplinary action for you. So your ANA, that they set the standard, and then in your state, they're going to establish a Nurse Practice Act, or the law. Okay, the law. If you break that law, then the nursing law, then you can go before the board. If it's something criminal, then you can have a criminal charge. But what you've done is you have not met the ANA standards. So each state creates a Nurse Practice Act, which is our law. It is to make sure that all nurses in the state are knowledgeable, safe, and give good nursing care. It defines the scope of nursing practice. It excludes unlicensed assistant personnel from practicing and calling themselves nurses. You create a state board of nursing to license the nurses. It also defines legal requirements for an RN and for an LPN, and it defines our education and licensure requirements. When you told your buddies you were staying home tonight, I thought you were going to have a romantic night in, not help you study for boards. That is so funny. So now let's talk about future trends in nursing. Nursing shortage. We are entering another nursing shortage. When I got out of school in 1998, it was the beginning of a nursing shortage, or kind of the middle of a nursing shortage, but it wasn't long. That one didn't last very long. So when I got out, it was easy to find a job. But before I graduated, when I first started nurses, there were pages and pages and pages in the newspaper. Because remember, y'all, we didn't have the internet back then. So you'd look in the newspaper and there'd be pages and pages of want ads for nurses. And then when I got out, there was still some, but not as much. But nursing shortages run in cycles. There's a shortage and everybody goes into nursing, and then we have too many nurses, and just it's cyclical. The difference with this one is COVID has made a huge difference. It's decreased the number of people that want to be nurses in one respect, because they're realizing that nursing is not all glamour, and you're exposed to things and you work all kind of crazy hours. But it's made a lot of other people want to be nurses, but maybe they can't quite cut it because they're thinking of the money. Then it's also pulled nurses to be travel nurses, so the local hospitals don't have nurses. So it's the nursing shortage is something we always have to combat. Nurses are the largest group of healthcare workers. It is important that we use evidence-based practice to make sure that our standards are always adhered to. Sometimes shortages or short staffing can affect the quality of care that you give, and we have to speak up about that. Community-based nursing is where we're moving in the future. Right now, most people are seen in acute care, but as time goes by, you're going to see more and more community-based nursing, and these big, huge hospitals are only going to be for emergent and very acute care. They got different things such as a hospital at home, visiting doctors, visiting nurse services. So you're going to see more and more care out in the community and less in these centralized hospitals. And the other thing you need to know is we're going to be taking care of older people. If you don't know what baby boomers are, you need to stop and look it up. The baby boomer generation is the generation of people that were conceived right after World War II. When World War II ended and all the men came home from the war, well, everybody got pregnant, and this big, huge boom of babies was born. Well, now they are our elderly. They are our 60s, 70s, early 80s. And that's what we're going to have a lot more of those coming. So it's called the graying of America, because right after the baby boom, then there weren't a lot of babies born. So we got this huge amount of elderly and not as many younger people right behind them. Because we have so many older people, the older you get, the more chronic diseases you have because your body's wearing out. So we're going to see a lot more chronic diseases to manage because we have a lot more older people. Now we have culturally competent care with all the different cultures of all the different people in our country and continually increasing. We have to be mindful of that. And then we have nurses that are more independent now, like nurse practitioners can be in a clinic all on their own in some states. So that's changing in the future. So that's kind of the history of nursing. Now I'm going to briefly talk about the nursing theory. And when I say brief, very brief. I'm not going to spend a lot of time on this because when you go get your bachelor's degree, believe me, you're going to have to learn a lot about nursing theory. So right now I'm just going to touch on the part I want you to know. Okay, this is from chapter 2. We're going to talk about foundations of nursing, which we just did, the theory, research. We talked about evidence-based practice in that other module. So nursing is comprised of 2 main elements, a body of knowledge, so you learn and then you apply that knowledge. So think of it as nursing school. You go to lecture to get the knowledge, then you go to clinical to apply it. The body of knowledge is obtained through formal training, historical information, ongoing research, and development of nursing theory. Evidence-based practice is tied to nursing knowledge and theory. So where does our nursing knowledge come from? Well, we got traditional knowledge, authoritative knowledge, and scientific knowledge. Traditional knowledge is the part of nursing passed down from generation to generation. A lot of times it's based on subjective data. This is the way we've done it forever, honey. That's what the older nurses will tell you. And a lot of times it's the best thing. Authoritative knowledge comes from an expert and is accepted as truth based on the person's expertise. An example, a new nurse hired on a unit is taught to shortcut to do a process by a seasoned nurse. The seasoned nurse is seen as an expert in the eyes of the new graduate nurse, so the knowledge is authoritative. Okay? And then scientific is arrived at through the scientific method through using research, where we test new ideas. So in nursing school, you're going to get authoritative and scientific. Our nursing interventions are based on scientific rationales to back up why we do what we do. This is an example of a care plan, which you're going to be spending a lot of time making care plans in nursing school. You don't really know what this is yet, but this is called a nursing diagnosis. So activity and tolerance. What that means is the patient cannot tolerate a lot of activity. Related to impaired gas exchange. I got thick secretions here. He's got thick secretions in his airway, which is impairing his gas exchange. So he's not getting enough pneumonia, not getting enough oxygen, which is making him not be able to tolerate this activity. It is related to pneumonia as evidenced by shortness of breath. So the patient's having shortness of breath, which makes him not tolerate activity. And the reason he has that is he has thick secretions because he had pneumonia and he's not getting enough oxygen. So all that's what I've seen, and that's my diagnosis. What I hope to happen while I'm taking care of him is that he'll be able to ambulate from their room to the nurse's station by bedtime tonight without shortness of breath. So what I want to do is increase his tolerance of activity. How am I going to do that? That's my interventions. Assess the vital signs every 4 hours. Well, is that because I think it's a good idea? No, I have a scientific reason for that. Monitoring vital signs provides a baseline information for comparison of changes. Respiratory patterns show effort to meet oxygen needs. Heart effort shows effort to assist the respiratory system. All this is telling you is when I do an intervention, I have to have a scientific reason for doing it. I can't just do it because I think it's a good idea. So in the beginning, nursing had no real theory. They were taught by physicians, or they just did things. They did hands-on skills. They simply followed orders. They had different kinds of educational preparation based on the school they were in. Education wasn't as big a focus as what you could do. With increasing numbers of women entering the workforce and seeking higher education, nursing also began to organize and develop a nursing science based on nursing theories. The one theorist I want you to know about is Florence Nightingale. She was our very first nursing theorist. She demonstrated efficient and knowledgeable nursing care. She was the first person to define nursing as something separate from the doctors. So she differentiated between health nursing and illness nursing. The training of these nurses came from the physician, so it was some medical, but she's the first one to say what we do is not medical, it is nursing. So what is a theory anyway? It sounds like a big bunch of hullabaloo. Well, it is a set of principles on which the practice of an activity is based, a particular conception or view of something. So what nursing theories do is they offer us a well-grounded reason for how and why we do what we do. Well-developed nursing theories are important to help you provide the best care. A theory is composed of a group of concepts that describe a pattern of reality. Theories come from research. Nursing theories, again, come from research. Ideas, actions, or hypotheses tested, and a theory develops. Simply put, theories are attempts to describe nursing based on data that's gathered. You remember these? This is our Erikson's and Maslow. Keep that in mind as we move forward. Okay. The relationship of theory to nursing practice. Theories generate nursing knowledge for use in practice. It provides the rationale or reasoning for nursing interventions. Theories identify concepts that are related or not related, and they can direct how to use the nursing process. It guides nursing practice and generates knowledge. It helps us to describe or explain nurses, and it helps nurses to know why they are doing and what they're doing it and why they're doing it. Now, the one I want you to know about is Nightingale in the upper left. She's the only one. When you go to the bachelor's program, you're going to learn about Rogers and Roy and Watson and all them. I don't want you to know about them right now. I want you to know about Nightingale. Her focus was on the environment. She separated nursing from medical. The reason I have Orem in blue is that's the one, my bachelor's program. I went to Alcorn State University. I got my bachelor's and my master's there, and their school used Orem as their theoretical foundation. I just put that so you would know that I had to go through all this too. With Orem, it helped patient attain self-care. But the one I want you to know about right now, while you're in this associate degree program, is Nightingale. She knew that there was a difference in the practice of nursing and doctors. She spoke of the nature of nursing as a profession that requires knowledge distinct from medical knowledge. She's considered our first theorist. She said nursing is unique from medicine, psychology, and social work. Our practice incorporates a little bit of all these into a holistic view of the patient and the family. Research is to examine carefully or to search again. It uses scientific inquiry. It uses observable and verifiable information collected in a systematic manner. The goal of nursing research is to develop explanations and find answers to questions or problems. Research findings used to develop our evidence-based practice. Go back to that and watch the evidence-based module if you don't understand it. Research is necessary for any discipline to be considered a profession. Nursing is a profession with a body of research, continually learning, validating nursing knowledge. Without research, nursing would just be a set of tasks and skills that we're doing for no particular reason. Then research is what binds it all together. This is our conceptual framework or competency model for Holmes Community College. This is actually the Mississippi Nursing Competency Model. And you can see that it has evidence-based practice right there. We do patient-centered care. We teach you to be professionals, how to be leaders, systems-based practice, informatics, which is computers and numbers, how to communicate, teamwork, safety, and quality improvement. So this is our theoretical framework or our competency model. And that is the end of nursing theory and historical perspectives in nursing. I hope this has been helpful. I tried to carve out only the important stuff that I felt you needed to know to understand, and of course to pass your test, but to have an understanding of the historical perspective of nursing and theory. And this is really all you need to know at this level. Again, once you go on and get your bachelor's degree, believe me, you will get a lot more. So I hope to see you in class soon.